Today, I really want to introduce two very powerful women who I only just got to meet and know. All right, first of all, I want to welcome Dr. Michelle.
Hi everybody. Hi. Hi, I'm Michelle. I'm a radiation oncologist. So that means that I actually use radiotherapy to treat cancer patients. I'm currently in private practice. So my group is called Asian Alliance Radiation and Oncology. But before this, I was actually at NUH or National University Hospital for more than 10 years.
Wow, sounds very cheap and you sound very experienced. I can't wait to learn more from you today, Michelle. And next, we also have a cancer survivor patient today here with us. Her name is Karen.
Hi everyone, my name is Karen. I'm a cancer survivor patient.
Wow, so many
you.
stories here today. Yeah, tell us more about yourself, Karen.
Okay, I'm 41 years old this year. I was diagnosed with cancer at 38 years old during the COVID pandemic time.
Oh, so that was about 3 years back.
Yes. And I was diagnosed with stage 1 cervical cancer.
Wow, that's insane. I cannot imagine what you must be going through when you first heard about that. Is it okay to share with our viewers here today? Like, what went through your mind when you found out that, what, I got cervical cancer?
It was not easy. The reason why is because during the pandemic that time, the first year, my late mom and my husband had some health issue.
Okay.
So the second year of the COVID pandemic, I was diagnosed with stage 1 cancer, same month as my dad. My dad has a stage 4 cancer during that time.
What? The same time?
So over the past 2 years was quite a difficult period of time for me to handle the situation. So during COVID that time, the restriction was quite also tight. So most of my treatment, surgery, I go alone. I went alone. Yeah. So during my surgery day, that day itself, my husband couldn't really send me to the hospital. I mean, like he can send me to the hospital at the drop-off point, but the admission part, he couldn't accompany me.
Oh no, because of the restrictions.
Yes,
lah,
yes,
right?
yeah. So after the surgery, he has to go for swab test also before he can actually go and visit me.
Yeah.
Yeah, so this is quite a number of restrictions during the COVID time that time.
The process must have been so difficult, but
Yes.
you overcame everything. You are a survivor.
Yes.
Right? So, how are you feeling now? How's your body doing now?
I'm still adjusting because I entered menopause straight after my surgery at the age of 38 years old.
Is there a reason why that is so? Or?
My doctor gave me two options.
Okay.
The first option, because I was stage 1 cancer, so the first option is just to remove that part, the tumor, after that for radiation. No chemo need to be done because of stage 1.
Okay.
The second option is to remove the female organs and also do radiation, but the chance of recurrent will be much, much more lower. I choose the option 2. 2 reasons. First reason is because I did have previous miscarriages before. That so was not a very happy
Of course.
experience lah.
Heartbreaking.
So my husband and I, we have more or less already decided not to have kids. And the second reason is because of my late friend Joyce, because she has stage 1 cervical cancer also at the age of 36 years old. And unfortunately, 1 year plus later, she's about 30 years old, her cancer relapsed. So she entered stage 3. But unfortunately, she passed away. Yeah. So this is also one of the reasons why I chose option 2.
So sorry to hear that.
Yeah.
babe.
So this is one of the reasons why I chose the option 2.
I see.
Yes.
So to all viewers here today watching the live stream, I want to encourage all of you to ask questions. Okay, we have professionals here on board. We have people who went through the entire journey. So whatever questions you might have, just leave them in the comment section, and I will read them out in a while. Okay. But whatever Karen mentioned just now, it's cervical cancer, and it's part of gynecological cancer in general, right? So
Yes.
Michelle, can you please tell us more? What is gynecological cancer?
Okay, so gynecological cancer is basically any cancer that comes from the female reproductive organs. Okay,
Okay.
so mainly the cervix, the ovary, and the uterus. Okay, so just to maybe, give a bit of show and tell.
Yes, why do you have a pair here? Tell
Yeah,
us.
okay. So most of us, in most of the textbooks, actually, the uterus is described as a pear-shaped organ. Okay, so usually it's an upside-down pear. So the pear makes up the uterus, okay, and on either side of the pear is actually where the ovaries sit. Now, the bottom of the uterus, that's what we call the neck of the uterus. That's where the cervix is. Okay, so in any of these 3 organs, okay, cancer can arise. And so for Karen, cervix will be at the neck, at the bottom of the uterus. But of course, you can get cancers, in the uterus or in the ovaries as well.
Okay, so three types of cancers
three types.
basically. And what is the most common type of cancer among these three?
Okay, so in Singapore,
Okay.
let's just talk about cancers in general. The top three actually are breast, number one for
Okay.
for females. Okay, I think everyone probably knows this already. Followed by colorectal and then lung. Okay, fourth and fifth are actually uterus, so uterine or endometrial cancer, and then ovarian cancer, and then cervical cancer actually comes in at about nine-ish or 10. So still, all the gynecological cancers actually are in the top 10 most common female cancers.
Right.
Yeah.
Wow. And what made you, want to specialize in this field?
Okay. Yeah, I get asked that quite often. So actually, it sort of goes back to when I was training, when I was a junior doctor. I remember sort of sitting with my more senior, male colleagues, and when a female patient would come in, sometimes I could notice that they were a bit uncomfortable and a bit awkward, especially if it was, a breast cancer patient or a gynecological cancer patient. Obviously, these are sensitive areas for ladies. But, and sometimes the patients would actually say, hey, doctor, actually, can I just see you? Can I not see, the senior doctor? Because they just weren't comfortable with a male.
Yes.
And I felt, at that point I was still junior, so I said, oh, I'm really sorry, I can't. But that sort of, made me decide to pursue or specialize in the female cancers, because I basically wanted to give female patients a choice, right? That if they were more comfortable with a female doctor, that one would be available. But if not, that's totally fine too. Obviously there are, tons of male doctors, and female patients are okay with that. And also I think, for me, I also just thought of myself, right? I always try to put myself in the patient's shoes. And I personally would have been more comfortable and I would feel that I could relate better with a fellow,
For sure.
fellow girl. That's why we're here
Fellow
doing girl
lady,
talk.
yeah.
So I just wanted to give patients that choice, really. Yeah.
Wow, thank you for doing that. Elizabeth here has a question. How do you prevent these types of cancer?
Okay, so maybe we'll talk about cervical cancer first, because
Okay.
since Karen is here. Now, cervical cancer is mainly driven by the HPV infection. Okay,
Okay.
HPV being human papilloma virus. Okay, so it's a viral infection, and now this infection, people can get it. Usually, it's passed through skin-to-skin contact through sexual activity. Okay, so you may not know you have it. Okay, because actually, HPV infection is asymptomatic, meaning it doesn't show symptoms.
Okay.
Now, most of us, if we have a healthy, good immune system, okay, we will be able to clear that virus on our own, okay? But for some where, maybe your immune system is, for whatever reason, a bit weakened, that's when the virus can sort of take over and cause some changes in the cells, in the cervical cells, and then from there, that's how the cancer develops.
Okay. So are we saying that people who haven't had sex before will never get cervical cancer?
Okay, so I always say never, okay? And unfortunately in medicine, with treatments and all this, nothing is 100%, okay? We can never guarantee anything. HPV, I would say, contributes more than 90%, causes more than 90% of cervical cancers.
Okay.
But there is a very tiny, small proportion of cancers that do develop because of other reasons. We usually say that a lot of cancers, the cause of it is multifactorial, meaning it can be anything from your diet, your lifestyle, environmental factors such as pollution. All these can come together and sort of cause cancer. Oh, and stress as well, which is very, very important.
Then I want to ask Karen, have you ever thought about why you? I know
Oh,
a lot of
yes.
cancer patients, when they, as we call it, kena, we always think, why me? Why
Yeah.
me? So why do you think? Was it because of how stressed you were during the COVID period?
I have been a caregiver for my parents for many, many years. I think during pandemic that time I was quite stressful is because also the first year of the pandemic, my late mum just passed away, sudden passed away, and my husband had a stroke after that. So
Like everything together.
Everything together. Then the second year is me and my dad have the cancer at the
Cancer.
same month together also. But like the doctor mentioned about stressful or the diet or the lifestyle, I feel that maybe it's partly stress. I think more likely for me it's more stress. Because I used to work very long hours, my previous jobs. So I feel that the stress is part of it also for myself.
So stress and a weak immune system basically can contribute to this, but we're not saying that these are the only two factors that can cause cancer. Am I right? Okay, let me see if there's any other questions. Okay, for now we are good. Ming Sing, I also see your text. To everybody who's still here, please feel free to drop more questions. But in the meantime, I want to understand a bit more about the connection between HPV and gynecological cancers.
So, like I mentioned, HPV mainly just causes the cervical cancer.
HPV is a type of bacteria.
It's a virus. Yes, it's a
Okay,
virus.
yes.
Okay. And like we mentioned, it's passed mainly through sexual activity.
Okay.
Very rarely it can actually be passed from a mother to the child during childbirth as well. But that's quite uncommon. Usually we do all the checks, for ladies as well when they're pregnant. Now for uterine and ovarian cancer, okay, it is not related to the HPV virus at all. For uterine and ovarian cancer, there can be a genetic component. So sometimes there are mutations in us, okay, that can increase the risk of developing these cancers. Of course, these genetic mutations in general, they're quite rare. Okay, so things like BRCA or BRCA, which is quite commonly heard about because it also causes breast cancer. So that one can actually increase your chances of ovarian and endometrial cancer. But other things like obesity, okay, diabetes, okay, also increases the risk of endometrial cancer. The other thing is prolonged estrogen exposure. So estrogen is the female hormone that we all have, okay, in us. And of course, it's in normal levels, manageable levels in our bodies. We have lots of checks and balances to keep this all in the right level. But say, for example, you take the oral contraceptive pill, or if you've reached menopause and you take the hormone replacement therapy, you are then introducing, more estrogen hormone sort of artificially into the body. Okay. And so now, because of a lot of these cancers are hormone driven, okay? So when there's an increased level of the estrogen hormone inside the body, sometimes that can also cause an increased risk of these cancers developing.
Oh, I see. A very random thought. Has anyone ever gotten these three types of cancer together? Is it possible? Cervical, uterine, ovarian.
So yes, it's possible. Okay. I do actually, quite interestingly, it is not that uncommon to see at least two together. So quite commonly, we either see uterine with ovarian, okay, or uterine with cervical. Yeah, cervical and ovarian not so common. Yeah, not so common. But yes, it again quite sway to kena both, but it does happen. Yeah.
Wow. And Karen, what about you? Before you got cervical cancer, how much do you know about gynecological cancers?
I know quite well is because my late mom has breast cancer. So she has her breast cancer maybe about 60 years old, at the age of 60 years old. So about stage 3.
Okay.
Same lah. Old people don't want to go for a self-checkup. So it was quite late that she realized she has the lump grow bigger. So she went for a check, then noted that it's stage 3, then go for surgery, radiation and chemo. So from there, I know quite well about breast cancer. It's about the treatments, how tiring it is, how tedious is everything. But for female cancer like cervical cancer, I do hear before, but I'm not too sure what is about the symptoms and the prevention.
So you mentioned you went for surgery. Did you go for radiation or
Yes, radiation.
or radiation as well?
Yeah. Two
And-
things, yeah.
Yeah, that process must have been like so tough and so tiring for you.
Super.
Walk us through that process. What is it like?
Super. I have a 30 cm scar on. It's like a C-sec lah. You give birth, like how a 30 cm scar. So it is very painful, but it's not as painful as I need to wear the urine catheter for 2 weeks because of the bladder part lah. So I need to wear that at home. So imagine I wear that for 2 weeks. Very, very uncomfortable. I cry every day because it was so uncomfortable. I need to adjust how should I say? I need to adjust the tube to make sure that my urine is flowing correctly. And the moment once the bag is full, I need to change and empty it. So imagine at night, halfway through, I have the phobia of it's full. Is it full or not full? If it's over full, I will leak out the whole floor. So that 2 weeks is the most struggle. Showering also is a struggle for me. Get out of the bed is struggling. That is more painful than the surgery to me. To me, this is the worst among the whole treatment. After that, I need to rest for about a month. Then I go for radiation. Radiation is 27 section. That one is the external radiation. But that radiation caused me to have diarrhea every single day because it's very sensitive to my bladder side. So every session when I go for my radiation, I need to drink a liter of water first to make sure that the water can push up my bladder.
Yep, that's
And
right.
doing the ultrasound first. If the water is too full, I need to lick a little
A
bit.
little bit, yes.
Yes, I don't know how much. Yes, if it's too little, I need to drink more.
Yes. To feel again.
So even though the radiation is only 5 minutes, but it's like 1 hour because of the water to drink it, or whether is it full or not full. So 5 minutes, no pain, no hot, no heat whatsoever. No, it's just tired because every day I need to go to cancer center to do my radiation every morning. So it's 27. It's about 1 month plus. After that, I need to do a 2 times internal radiation.
Yeah.
That one will make my vagina dry. I still have vagina. The rest I don't have, but I still have vagina. That one will make me dry, so it can bleed easily.
Oh,
Yeah.
man.
So the other thing, the side effect will be diarrhea. I can have diarrhea one day more than 20 times. Because it's too sensitive to my bladder until there's nothing. No?
Yeah, but
Just
how do
pain.
you have diarrhea 20 times in a day when there's
It's just
nothing
like
left
from
to come out?
something to nothing to pain. So I wish like I can wear Pampers.
Why
that
don't you
period
do
of
that?
time.
Why didn't you do
I
that?
didn't do that. I just feel very upset when I couldn't control my bladder. Like after when I do each day treatment finish, my husband will remote me to go to a shopping center to have a lunch
So
or what,
sweet.
right? But
That's great.
I will have phobia because I may scared that I will have diarrhea.
You
And
may
I
leak
cannot
up
control it.
inside.
I cannot control
Yes.
it.
Yes.
And there's a few times I really cannot control it and I cry. Yeah.
You mean at home?
At home or outside. I couldn't control it.
And I'm actually looking at Karen's husband off screen right now. He's so sweet. He came here all the way with Karen today to show her moral support. So shout out to you. Kudos. Aw. I think a very strong caregiver or like someone who supports you throughout this entire journey is very, very important.
It's very, very important.
Especially how he didn't give up, seeing you through all of those.
Yeah.
He still
I didn't
supported
give up on
you.
him first. When he have stroke that time, I was the one also by his side. Yeah. Then now it's my turn. Then it's his turn to look after me.
Oh, that's such an incredible story. Okay, I'm gonna read up some messages from our viewers right here. Okay, okay. Well, Xavier, does fasting for a certain period of time help reduce the growth of cancer?
Okay, so I think there are lots of myths about, what diet we should have. And there are lots of fat diets as well, right? Like high protein, low sugar, vegan, gluten, lots of different diets. Now, in general, okay, so a very common myth is that sugar feeds the cancer cells, right? And so going to Xavier's question, if you fast and then you, I guess, decrease the amount of sugar in your body, will that sort of starve the cancer cells? Not really, okay?
Also, sugar doesn't feed.
It's not that it doesn't feed. Okay, all our cells, every cell in our body, from our brain to our liver to our lungs, everything needs basic sugars to function. Okay, so whatever you eat, most of the things, say you eat carbohydrates, say you eat fats, eventually it will get broken down into sugars that can be used as energy for our body to function. Okay, so if say you completely cut out sugar, okay, you're just going to feel very run down, right? You're going to be tired. You're not, and in fact, by doing so, your then immune system is also going to be run down, and then you're just going to increase your risk actually, of getting, other cancers because you're just feeling stressed and tired and hangry and all this sort of stuff. So I don't recommend doing anything too extreme. Okay, in general, and it's very boring basic advice, but it holds true. Okay, which is just live a healthy lifestyle, everything in moderation. Okay, there's no need to specifically avoid certain food groups. Of course, sure, cut down, right? Let's not eat too much fatty food. Let's not eat too much sugary things. But you can always treat yourself every once in a while. It's totally fine, right? I think we should enjoy life. Life is here for
I
us.
love my mala. I cannot do without it.
It's fine. No, and I have my guilty pleasures too, right? I love durian. I love all sorts of stuff. And so I think again, everything in moderation. If you had, I'm not asking you, I don't suppose, like sort of having, durian every day is a good thing, okay? But sure, if you have it, once a month or, even twice a month.
I just had it last night.
Yeah, it's fine. It's not gonna move the needle on whether or not, you're gonna get cancer. Yeah.
Okay, there you go, Xavier. You have your answer, okay? Everything in moderation. Next, Wei Jie. She's a female, by the way. Okay, she says, I think not many women take HPV vaccinations. I took mine and my friends weren't aware to take it. Is it true that it's still more effective for women to take HPV vaccines before sexual contact?
So yes, okay, ideally, that would be the best, okay, which is why it is currently offered to our secondary 1 and secondary 2 students. Yes, okay. Actually, the vaccine, if you look at it worldwide, okay, it's available for girls from the age of 9 years old. Okay, I guess like in other countries, maybe they will start, having sexual activity a bit earlier. In Singapore, there is a current national guideline. There's a vaccination program in the schools where it is offered to Sec 1 and Sec 2 girls. Okay, of course, so we would encourage all the girls, if you're a mother, encourage your daughters to have it. If you're, a teenager, by all means, do get it if you haven't gotten it yet. So the vaccination's available for ladies actually from 9 years old all the way to you're 45. So even if you have had started sexual activity, it is still okay and it's still recommended to go for the vaccination.
So are you saying that women above the age of 45, if they haven't gotten the vaccines and nothing happened, then for the rest of their life, nothing will happen?
No, okay, unfortunately not. Okay, so because how the vaccine works is that what it's trying to do is prevent the HPV infection from staying and taking place. As you get older, the likelihood that the effectiveness of that vaccine then sort of wanes a little bit because you are more than likely to have already been exposed to the HPV virus by that point. Yeah.
I see. Okay, hope that answers your question. So Wei Jie asked, how young can a woman or child take the HPV vaccination to prevent it? As young as 9 years old, even though in Singapore we introduced it when we are 13, 14.
Yes.
Okay. And if we have taken G9, is it necessary to take the other strains in the future?
So the G9, cervical cancer is caused by the two main types of HPV is type 16 and type 18.
Yeah.
So they cause majority of them, but there are like many different strains, So G9 does cover about a few different, I think 9 strains, which is why it's called...
Does G9 stand for Gardasil?
Yes, Gardasil, that's right, yeah.
Okay.
So I think if you have taken G9, that's already pretty good. I don't think that you need extra. Because before G9, there was the vaccination that only, I can't remember what it's called, but it only covered type 16 and type 18.
Okay.
Yeah, so if you took that one, maybe you might want to consider the G9, but I don't think that we're doing that so much anymore since G9 is available. I would just say go ahead with G9 and you should be fine.
Okay, I'm going to try to answer this next question myself. Okay, so Jean Tai says, is the HPV vaccine only for younger women, or can I take it if I missed the vaccine in my 20s? Go for it. Yes. All right.
Yes, very good answer. Well done,
Did I answer
Hazel.
that correctly?
Yes.
Yeah? Okay. Now we know. Okay, this is very educational. Now, I want to talk a bit about early detection and prevention, which I think is very, very important.
Yep.
Like Wei Jie mentioned just now, not a lot of women or like girls in Singapore would think about taking an HPV vaccination. Not like they would go for a COVID vaccination. You know what I mean? It doesn't just come to top of the mind right away. So, Michelle, what are the different screening measures for these cancers?
Okay, so currently there is no sort of national screening program for uterine or ovarian cancers. Okay, so for these two cancers, normally we hope that by raising awareness about these cancers and the symptoms that they come with, thereby, if patients do experience any of these symptoms, which I'll come into later, then they would obviously go and see a doctor as soon as possible. So for ovarian cancer, the common symptoms are sort of generalized tiredness, abdominal bloating, or abdominal pain, sort of loss of appetite, maybe loss of weight. I know they're very general, so and they also can apply to many different other cancers, But of course, if you notice that you're just not quite right, and I always feel that patients know their body best, right? And you can tell when something's not quite right, you sort of know, right? And sometimes, people can be in a bit of denial or they don't want to know because who wants to know that they've got cancer, right? So people sort of maybe avoid going to the doctor straight away. But so my advice is don't avoid going to the doctor. And sometimes patients also tell me, I thought it was nothing. I know you're very busy. I didn't want to come and, cause the waiting times to be even longer. I say, no, please, this is your health. Please prioritize it. What we as doctors will be happy is that if you come to us, we check you and it's nothing. Then we're very happy, right? Because it's nothing and you can go off happy and we are happy also, right? So that's for ovarian. For endometrial cancer, it's usually abnormal vaginal bleeding. So, for example, if your periods are always regular, and then suddenly now sort of in between, your periods, you're starting to bleed. Or if you have menopause, which means you've stopped having your periods, but suddenly you start bleeding again. Okay, so these are very common signs that, something's not quite right. You should go and get checked out. Okay. Now for cervical cancer, we have a national screening program. Okay, so it's great, right? We have a vaccination, we also have a screening program. And so what the screening is that there's 2 tests that we can actually do. One is the Pap smear test, PAP, smear test. The other one is the HPV test. Okay, so what the Pap smear test does is I have something to show everyone.
Show us. She came prepared.
Yeah, I did. Okay. So usually in the pap smear test, actually for both pap smear and HPV test, what we're doing is that we have to insert this brush into the vagina. Okay, and I'm going to use my pear. So what we're trying to do, okay, is that we're trying to actually brush the cervix, okay, and then we're trying to get some of the cervical cells, okay, onto the brush, okay, and then once it's brushed, then we can actually put the brush into our container,
Okay.
and then this gets sent off to the lab to check to look for cells, the cervical cells, and to see whether the shape of the cells are normal or abnormal. Yeah, so from there we can tell. So if the pap smear comes back and it says that the cells are a little bit abnormal, then we would recommend that the patients go to a gynecologist, get a further test, which is actually involves looking at the cervix with sort of like a microscope to really carefully see whether there's anything abnormal
Is
in the
that
cervix.
Called a colposcopy?
Yes, well done.
Because
yes.
I've done that.
Oh,
It hurts.
okay.
I just want to say it hurts so much.
Oh no.
And it's so uncomfortable.
Yeah.
But I get it done anyway because I just
Okay.
want to be sure.
Yes,
And I'm
yes.
relieved that I've done it.
Yeah,
You know?
yeah. I guess it's not the most comfortable, but of course, yes. Obviously, if it's something that can save your life, then yeah, please do it. So yes, for the Pap smear test, actually from the age of 25, ladies can actually start doing it. For the HPV test, we actually can do it from the age of 30. So if you've done the HPV test and it's clear, actually you don't need to repeat it for another 5 years. Okay. If you've only just done the Pap smear and that's clear, you then need to repeat it in 3 years' time.
Okay, so the HPV test basically is on the lookout for the human papilloma
Yes,
virus.
that's right.
The Pap smear is on the lookout for cells,
Yes.
whether they're normal or abnormal.
Yes, that's right. That's right.
Wow. Okay. And then Karen, what were the signs that you saw before you knew that you had cancer?
Every year I have to see my gynae doctor because due
Okay.
to my miscarriage. So every year I'm very prompt. I will sure go for my checkup.
Wow, good. We need Singaporeans like you know, on the ball. I should learn.
But
Okay.
unfortunately, that time during the pandemic, that time, I delay my checkup is because due to the appointment need to be delayed because due to the pandemic that time.
Oh, the restrictions.
The restrictions.
Yeah, okay.
So I delay 2 months. So during that 2 months, I have prolonged menstruation. This is my first time I have prolonged menstruation because my menstruation is always on time one.
Okay,
on the
prolong
ball
as
one.
in the duration is very long.
Yes, and spotting also.
Okay.
So when I went for my checkup, I told my doctor about the symptoms. So immediately we do the cervix check. Unfortunately, saw a lump over there. On the same day, took out a little bit of tissue and sent for biopsy test. 1 week later, stage 1 cancer.
Really sweet. Oh,
Yeah.
but at least it's stage 1. You know what I mean? At least you found out early.
Yes, because I do my pap smear every year. Every year is okay one. Yeah, so like the doctor mentioned that sometimes, who knows, maybe after the check, then the virus
Yeah, maybe
develop.
you check today, then the virus developed tomorrow.
Yeah,
Like, you really
so we
never
will know.
right?
Yeah.
Did you cry when you found
Oh, I
out?
cried very loud.
You?
That day I cried very loud. It's because I already know my dad has a cancer. My dad is 1 week before I knew that he has cancer. So I cried very loud inside the room. I couldn't control it. So my first sentence is just said, please save me, Lord.
Yeah.
Don't let me die. Because I'm not ready to live. I still have my 2 dogs, my husband and my dad. So just do whatever you want to do and just save me.
Oh my God, I feel so emotional. Like hearing you talk about this. But Michelle,
Yeah.
I'm sure you've seen many patients like that who like cry in
Yes,
your
of
office and
course.
tell you, please save
Yeah.
me, doctor. How do you like even respond to that?
I guess, it is, nobody ever wants to hear that they've got cancer, right? It's a life-changing decision. It really throws everything, up in the air, right? It's very overwhelming. But I think, for me, where the angle that I come from is that, yes, I can see and I can understand how devastating it can be. But our aim, okay, is that we want to cure you.
Yeah.
Okay, we want to treat you for cure. Okay, meaning that this cancer is not going to shorten your lifespan by any means.
Yes.
Okay. And thankfully, like you said, you were stage 1. Okay. And stage 1 cervical cancers, in fact, stage 1 for most cancers, the survival rate is very good.
Yes.
Okay? Usually above 90%. Okay. So and actually that brings me back to why then, the screening is important.
Yes.
Because the screening allows us to catch cancers at an earlier stage. Okay.
Right.
The earlier you catch it, the better the chances of survival. So if we can catch it at a stage 1 or even a pre-cancer stage, which there are in cervical in cervical cells, that's great. We catch it even before it starts to transform into a cancer, or we catch it at stage 1 where we know that the survival rates are still very, very good. Yeah.
Of course. Okay, so someone is saying on the chat, she says, "Hi, my period is irregular. It comes every 4 to 5 months.
Oh, wow.
That is very irregular.
Very
what would you
regular.
say to someone like that?"
Okay, so first of all, I would ask her to just think back. Okay, have her periods always been irregular? Okay, now 4 to 5 months is extremely irregular. Okay, usually if you've always had irregular periods from young, okay, then actually that's probably your normal. Okay, and that's fine. But if you've had very regular periods and then suddenly or over the next few cycles it becomes irregular, then you've got to think, okay, is something not quite right here? So what I would recommend is actually for her to go and see a doctor as soon as possible. Okay,
As soon as possible.
Yeah,
That's the
as soon as
keywords, okay?
possible.
And I also want to bring up an issue that one of my closest friends had. Every month during her period, it would come very regularly. But the first day of the period would almost kill her. Like she cannot get out of bed. I can see her lips turn pale. She's not able to come up to work at all.
Yeah.
I don't think that's normal.
Yeah.
Is
so
it?
unfortunately it can be normal for some, okay, but in the sense that there may be other conditions that cause your periods to be very heavy. Okay. Things like endometriosis, fibroids in the uterus. All these can have effects on your periods. It may not always be cancer, okay, but
Okay.
if it's something so debilitating, so crippling, it would be good just to go and see a gynecologist just to get the all clear, right? Like you just want to know that, there's nothing that we're missing, and again, right? I mean, even if she's had this, for years and for months, it sounds pretty bad.
Yes.
I think at least just going to get a check, or even with the GP, is worth
Right.
doing, Yeah.
On that note, why do you ladies think that, girls in Singapore don't want to go for screenings or don't want to get checked?
Okay, I have a lot of friends. They are just worried, pain, troublesome.
Oh.
Okay, it's very uncomfortable to do pap smear. It's very uncomfortable. I have many friends that say that it's very uncomfortable. Second, scared of results. To go alone for the test. And the awareness, the awareness of screening also is important to play a part also. So I do have friends that they didn't do their pap smear for even like years because some they thought that they just did once. Okay.
Oh, clear for life.
Clear for life already. But unfortunately, it's like 3 to 5 years. So some is just uncomfortable or they don't want to see the results. I think everybody was scared for results, to be honest.
Of
But for
course.
me, after when I have cancer, diagnosed with cancer, I will reply to my friend, say that, but it could save your life.
Yes.
Yeah. To me right now, my answer will be it could save your life. The 5 to 10 minutes uncomfortable, but it can save your life. Yeah, but for me, maybe if I don't have cancer, I wouldn't want to go for a check. But for me right now, I have cancer. I will say that to you. It can really save your life. Waiting time for see a doctor for 1 hour or doing the check for 15 minutes or 10 minutes is not as what I've been through right now. The pain and the treatment and the side effect right now. So
For
this is
sure.
what,
And then, Michelle, from a professional perspective, why do you think screenings are, I wouldn't use the word frowned upon, but like are shunned even by
I
people?
think there is still a stigma with cancer, and even more so, say like cancer of the cervix or our the female reproductive organs. I also think that it's not something that girls really chat about, right?
Yeah.
I mean, we're Karen and I are the same age. We're entering the age where actually we've got to start going for breast cancer screening and and all the other screenings. And I realized that even with my own girlfriends, actually I have to catch myself, and I'm like, I'm a doctor. If I don't remind my own girlfriends to go, I'm doing them a disservice, But even though, they hear it from me, sometimes they still don't want to go, And I think, people are busy, right? We live in Singapore. Everyone's living a very busy life. Just I guess they don't prioritize their health, right? And they think, and a lot of people think, it's never going to happen to me. I've lived well, I exercise, I eat well, it's not going to happen to me. Now, unfortunately, cancer doesn't choose its patients that way, it just happens. And so, I think if anything, just take some time to just prioritize yourself, your health, and just go for this check. Like I've had it done before myself. I know it's uncomfortable, but like Karen rightly said, it can save your life. So why not? Why not? It is just one doctor's appointment, and it'll be over fairly quickly. Yeah.
So set your fears aside and just go, right? Another question. Where can I book appointment to see Dr. Michelle?
Okay, later I give
Nah, I think a lot of people want to see you after this chat, you know.
Yes. No, I'm very gentle.
I can see that. Okay, the next question. When is the best time to get your pap smear and HPV done? Can it be done together? Because I remember it can be done in one sitting. So remember just now you mentioned 25 or 26 for pap smear, about 30 years old for HPV, am I
Yes,
right?
that's right.
But can you get them done together?
Yes, you can. Yeah. So we will basically, it's just one process, one procedure, and then we'll send it for both tests. So no problem.
Ah, okay, okay. 水流 can derive to become cancer.
水流. 水流, I think, is a cyst, okay, or what is sort of a water-filled
Yes.
lesion, okay. So usually not, okay. Most cysts are just what I said, they're just water-filled collections. Most of the time they don't, okay. But in some ovarian cancers, they do have cysts that can transform, okay, if certain parts of the cyst lining sort of start to mutate and form sort of more solid components. But in general, okay, it shouldn't.
So like dermoid cysts, they are very common in women,
Yes.
right? So they should be relatively okay if you
Yes.
get it cut
Yes,
out,
yes,
right?
yes, yeah.
Okay. I have no idea how to pronounce this word. Are fibroids?
Fibroids, yep.
Fibroids in the womb normal for middle-aged women? Can fibroid lead to cancer?
Okay.
What
so,
are fibroids?
Okay, so fibroids are sort of benign, so non-cancerous lumps, okay, that can form in the uterus.
Okay.
You can actually also get them in the breast, okay, but they're benign. Okay, so they're non-cancerous. In general, they don't always turn into cancer, but we do want to monitor them because sometimes they can. Yeah.
Can we feel them?
You can't.
Okay.
Okay. You can. Oh, so in the breast you can. Sometimes you can if they're big enough. But in the uterus, of course, you can't because it's too deep inside. So you won't. Actually, you may not even know that you have fibroids. Okay. Yeah. So we may have. Okay, but we just don't know. It's okay if we don't have any symptoms. But like I mentioned earlier, sometimes some fibroids can also cause very heavy bleeding or cramps during that periods, which is why your friend who has very debilitating symptoms. Maybe it's because of the fibroids, and then maybe you want to, get it checked out. Yes, and sometimes they will remove the fibroids. The gynecologist will do surgery to remove them.
Okay, got you. The next question strikes me as a little funny because I have no idea what it is. Hi, may I know if ginseng and tsiakpo, what is that? CIAKPO, will increase the size of tumor? Please enlighten me. Does anyone? 甲补. Oh,
What's 甲补？
吃补, eating nutritiously.
Okay.
Eating lots of like good nutrients.
Oh, okay.
So like ginseng.
Will it prevent cancer? Is that
Will
the
it
question?
increase the size of tumor? Because
Oh.
sometimes you want to feed like the nutritious stuff.
No,
in
no,
your
no,
body,
no,
right?
no. Okay, so okay, I get this question very commonly as well about sort of TCM, traditional Chinese medicines, or all sort of these bird's nest, ginseng. Again, I think it probably won't move the needle, okay, as to whether or not you're going to get cancer or not. Whether it's going to help or prevent, I also don't think so. There are no sort of properly
Statistics.
run, evidence, clinical trials that have shown to look at these things. There are, you may, Google and then you'll find all sorts of like small case reports or write-ups, but I wouldn't believe everything you read on the internet, okay? So as for doctors, obviously we practice evidence-based medicine. We want to make sure that any of the treatments or the recommendations that we give do have proper evidence backing them. So things like this, unfortunately, at the moment, no. There's no evidence.
So can eat the ginseng, it won't increase the
Yes.
size of your tumor.
Yeah.
Okay, got it. So interesting your questions. Okay, I want to circle back to that girl who said that her period comes every 4 to 5 months. So she says that her period was regular from P6 to SEC2, but then became irregular for 4 months onwards after. Saw a doctor, they gave her medication, but her period is not here yet. How?
Okay, it also depends who she saw.
Okay. Maybe
so
it's like a GP?
Yeah, so maybe
Okay.
if you see a GP, the GPs usually sort of may not do very
Specific
in-depth
checks, okay.
checks and investigations. I might suggest that she tries to make an appointment with a gynecologist to just maybe do more specialized tests.
All right. Now this brings me to my the next conversation that I want to have. For people who have gotten cancer, how does this affect you? So Karen, like you mentioned just now, you cried in the clinic upon knowing that you had cancer. And how was it like every single day for you? Besides the radiation and the surgery you had to go for at home, was it like you're crying every day?
Every day. Every day, because it's very tiring. The journey to the place, after that you went back home, your body is just drained out because of the side effects. and the worry of the anxiety.
Right. Does the side effect cause like anxiousness
Yes.
on top of what you're already feeling?
Because before surgery, you will say, faster cure me. I want my cancer to be away. After surgery, will my cancer come back? This is the anxiety that every single day I'm worrying, Googling. I would strongly recommend everybody that stop Googling
Yes, thank you.
because you only want to hear the good answers. But when you read the bad answers, you will trigger yourself that, oh, jialat, is it this? Is it that? Oh, so anything I'm unsure, just listen. I just seek your doctor advice.
Right.
Because I during that period of time, I Google too much. And I'm over anxiety. That after right now, when I have my PET, I do still do my PET smear every 3 to 6 months.
Oh, 3 to 6 months.
Yes, yeah. Now it's about 6 months already. It was every three months. Now it's 6
Okay.
months. Again, same. Every time I had to wait for the results, the anxiety comes back. So I don't think it would be no anxiety. It was for sure there will be some anxiety here and there.
Then what can you do to adjust your mindset? Or like what, how has your husband helped you in this process? Why you laugh?
Because he every time say, you really remove everything already. What else will come?
Hey, but actually he has a point lah.
Yeah, he said
Right?
everything already remove already. What else you worry
Wait, but
for?
everything, what do you mean?
All the
Like-
female organs are already removed already. I only left the vagina part only. So he will say,
wow.
it's already everything removed already. What else you still want to worry about? There's nothing to worry about. You know, why you think so much?
Yeah,
Like,
like, then why you think so much?
my social worker,
Okay.
my psychology doctor, social worker from the Singapore Cancer Society, she did mention to me, what did the doctor say? You have 90% of recovery, right? Remission, right? Why do you think of the 10%?
Correct. Don't focus on the 10%.
She said that one that strikes me. Then I was like, yeah, I should focus on the 90%. I didn't thought of that until she enlightened me.
So how are you doing right now emotionally?
Okay, I still stress about the results, to be
Okay.
honest, but not as stressed as last time. I was just, okay lah, just wait for it lah. But my results were always, because when I do the swab, the pap smear swab, normally they will give the report, say negative or positive, but mine will not have any results because there's radiation inside.
Yes,
So the report will always shows, how do I say, because it's computer,
There's
computer
something,
do one.
yeah, that the cells don't look completely normal.
Yes.
Yeah.
So there's always in the, because there's still radiations inside the
Your body.
Yes. So the only way that I know the answer is doctor had to personally email me or call me.
So it's not that there's radiation in your body. Actually, there's no more radiation in your body, but the radiation induces changes in the cells.
Okay.
And that is what they're seeing on the pap smear. Lah.
Yeah.
So it won't look normal, but what we want to see is just make sure that there's no cancer.
And normal cells, right?
Yes,
The no
we just don't want to
cancers.
see cancer cells.
Yeah. So I always had to wait for my doctor to call me or email me for that.
Hey, then can I ask a very random question, just entirely out of curiosity? After you remove your female organs, do you become lighter?
No, I gain weight a lot because I enter menopause now. I enter menopause at 38 years old. So it was a very big blow for me because I'm not like the older women that they slowly entering menopause.
Okay.
I is immediately
So how,
after surgery.
please enlighten me, how does entering menopause cause you to gain weight?
Metabolism down.
Oh, okay, okay.
Metabolism down. I have very bad hot flush. Very, very bad. So I perspire non-stop.
Okay.
I very bad mood swing. My husband keep on kena by me. Yeah.
Bro.
A very, very, very bad swing.
Long
Yeah.
suffering, long suffering.
And very emotional. Very negative side.
Yeah.
So a period of time depression because can't think of the cancer and then my features. Do I look older because of
You look
menopause?
so good, Karen, okay?
For weight gain. This is my heaviest weight so far now I weight. Then these are the things that I'm still experiencing right now. And I have to on pill for hormone replacement medicine for maybe 5 years to lifetime because I don't have the estrogen
Yeah,
already.
yeah.
So I need to replace the hormones in my
I
body that
see.
what I don't have right now.
Yeah.
So Michelle, does exercise work in this case?
It does. But as Karen mentioned, of course, all us ladies, once we hit menopause, because there are hormonal changes, we will go through all the symptoms that she mentioned. Okay. Unfortunately, yes. So men out there, this is what we have to go through. Hope you all will bear with us when we do go through it. But also, I mean, you've been a real champion. Okay, you're such, you're so amazing. You're so inspirational. I think it's great to hear that you're still going out there and putting yourself out there, working, just doing, going back to normal daily life. I was really struck by what you said about how you're constantly thinking, right, about the cancer. And you're not alone. All my cancer patients feel the same way. One thing that I often tell them is that, whether you worry about it or not, it's not going to change whether it's going to come back or not.
Yes.
Okay. So, and then I tell them, okay, the reason why we have you coming back at 3 months or 6 months or 1 year, okay, it's because these are the time intervals that we know, okay, are set in place so that if anything comes up, we will catch it. Okay? So I tell patients, look, you try your best not to think about it. You leave it to us. Okay, that's why we have given you the appointment. Come back in 3 months. Come back in 6 months. If you don't come back, we will call you and we will make sure that you come and see us.
That's what my doctor also mentioned. Just always listen to your doctors and trust your doctors. My doctors always said, you listen to your body. If you know that something is unusual, suddenly you got bleeding or stomach cramps or not comfortable, just go for A&E or go and see your doctor for help. You know your body well one.
Yes.
That when you know it's not comfortable, you straight away go and see doctor.
Correct.
Yes.
So I guess by saying that, it's like telling you there's no point worrying about, what may or may not come because
Yes.
they might not come in the first place. So you worry for nothing.
Yeah.
Right. Okay, we have one question from Q Ning. Okay, doctor, do you want to take this question? There's a lot of technical terms in there.
Go closer. I cannot see very well.
I'm going to try to read it. Okay, if I had total hysterectomy due to endometrium cancer, do I still need to get an HPV vaccine or pap smear?
So no, you don't have to. Okay, if you had a total hysterectomy, it means that your uterus and your cervix have been removed.
Oh,
Okay,
like Karen.
yes, like
okay,
Karen.
Okay.
So so there's no need. Okay, there's your cervix is not there anymore. So there's no
Okay.
need to do the vaccine. Yeah.
Okay. Next question. For ovarian cancer, there seemed to be no screening. I heard that the CA125 test isn't actually accurate too. What should we take note of it and be sure that it's not a gastro issue?
Okay, so I get this question a lot as well because if you go for your corporate health screenings, they will always offer you a panel of blood tests that they call cancer markers. Okay, and CA125 is a cancer marker that we use for ovarian cancer when you have been diagnosed with ovarian cancer. Okay, if you haven't been diagnosed yet, it can be raised, okay, or abnormal for other reasons as well, inflammation or other things. So the question was, sorry, do I?
So how do you know whether you have
Okay, so I think-
ovarian cancer?
So, how do you know? Okay, so obviously, if you've gone for a health check and your CA125 comes back as raised, then the doctor will advise that you go and do further investigation. So it may include a scan, it may be an ultrasound scan, just to check the abdomen, make sure there's nothing there. But if it's only very slightly raised, it's quite unlikely that it's going to be cancer. Of course, if it's very markedly raised, then okay, I think that is maybe a cause for concern, and you should go and see a gynecologist to get it checked out. But if it's quite low, quite non-specific, like I mentioned, because it can be caused by other things, I wouldn't get too excited over it.
Wow. I love the way Dr. Michelle says her words, makes me feel so calm.
Yeah.
Even in the face of cancer, we're talking about cancer and she makes me feel so calm, you know what I mean? Okay, I just want to understand what are some of the psychological effects that your patients face? Maybe say right in your clinic. What's the
Yeah.
worst case you've seen?
So I think whatever Karen has mentioned and gone through, I think that's very, very common. So the anxiety, is very common. There's a bit of what we call an adjustment disorder as well. You've gone from being sort of a normal, healthy human being to suddenly being told that you are a cancer patient. Okay, and this obviously can, it definitely takes a toll. Everything that you thought was, right in the world has suddenly been turned upside down. Okay, so it does take patients some time to come to terms with it, right, and to realize that this is something that I need to fight, and that actually that's where the caregivers come in very important as well. Like you mentioned, having a supportive caregiver, supportive family and friends, I think that definitely adds and helps to the patient journey as well. So of course, I think it is very normal and natural to have those feelings, and I let my patients feel those feelings, right? I don't ask them to suppress it by any means. Okay, you need to go through that process of grieving sort of the loss of your normal healthy life. Okay, then coming to terms and acceptance of it. Okay, knowing that look, I've got this, and then now let's fight this, right? Let's fight this. Okay, you've got your medical team on your side. Okay, you've got your family, your loved ones on your side. Now let's do this all together. It's a team. We're gonna fight this, and we're gonna beat it. We're gonna beat cancer.
Yeah.
Yeah.
Wow. 真的不简单，真的不简单。Okay, a mashed potatoes loves. Another question: Can a person with amenorrhea go for blood donation?
Okay.
What-
So
what is
amenorrhea
amenorrhea?
is when you stop your periods, or you don't have your periods, or you stop bleeding. Basically, you can, okay, if your blood levels are normal. Okay. So they may want to just check that before you go to donate blood.
Okay.
Yeah.
Another person says, "Hi, I am single, 33 years old. I'm a lady. I have regular but very light periods, as in 2 days, 1 night, and it's done. Okay, I have done USG.
Okay. Ultrasound.
Oh, okay, and everything good. Am I entering into perimenopause? Do I need to have blood test to check AMH? What is AMH?
Anti-Mullerian hormone. Okay, so these are all the female hormones. Okay, so it sounds okay. So she said she's always had it, right?
Yes,
Yeah?
regular period but very light.
Like, okay, look, it's fine. I don't think you are perimenopausal. You're quite young. Okay, usually menopause happens sort of in late 40s, 50s kind of age range. It can happen earlier, yes, okay, but not so common. If you've always been like that, then I think that is just your normal, her normal. Okay.
Okay.
So I think don't need to be too worried. Obviously, if there are any changes in the future, then maybe you want to go and see a doctor. But for now, I think she's okay.
Okay, nice. Well, we are almost about to wrap up today's live stream. So if you have any more burning last questions, please feel free to, enter them in the comment section here, right on the live stream. But, we've spoken about so many things, from like gynecological cancer to preventing them to, what do we do if we find out that we are a patient of cancer? What are some main takeaways for our viewers here that you would like them to think about, Karen?
Okay. First of all, I just want to say, love yourself a little bit more. Okay, make time for yourself to do screening. If you feel that going there alone, you may worry or scared, ask your friend to go along, bring along, or ask your relative or your close one. Second is, cancer is not a death sentence. Anything, because right now the medical is so advanced. There's so many different types of treatments, not only radiation and chemotherapy. There's target therapies, etc., clinical trial, etc. So, like Dr. Michelle just now mentioned, caregivers are very important. But there are some patients who don't have caregivers or don't have much close relative or friends. But there's always other supports you can actually find. So for me, okay, this is one good thing that I Google. I Google Singapore Cancer Society. So I actually found the website, and then they really give me a lot of options like psychology, social worker, rehab exercise, because I have a scar. So I went back for exercise to gain back my energy, my body structure, everything.
nice.
Yeah, so there's actually other options for you to look out for. So if you're afraid of being alone or talk to someone else, you can always send a request of inquiry email or website or call.
Like anonymously.
Then ask for help or
Okay,
what.
okay.
For me, I will just Google to Singapore Cancer Society. I mean, they have the website, the official website, the telephone number to call to if you need any information or any help. So I feel that cancer is not a lone journey. It's a team lah.
Yes.
Yeah.
That's so uplifting. What about you? What are some main key takeaways?
So I think, as we covered, today, I think it's very clear that if we catch cancer early, survival is great. So I think prioritize yourself, prioritize your health. Work can wait. I think go and book an appointment. If you want to see me, I'm more than happy to see you. Okay, if you go to our Instagram, my clinic's Instagram, which is aaro.sg, feel free to drop us a DM. We'll be happy to set up an appointment. Just take action. I think for the men that are listening in, tell your mothers, your sisters, your wives, your girlfriends, your female friends. Just tell them to just please go. Okay, because like Karen said, 15 minutes of discomfort can save your life, right? And so why wouldn't you do that? Why wouldn't you?
Agree. I think you can really encourage your female friends, your loved ones to go for a screening, especially they have a no-cost screening available at the SCS Bishan clinics or the Healthier SG clinics. Go for early, regular screenings, no cost at all, or can just follow Singapore Cancer Society on Instagram for more updates. Keep yourself always exposed to the knowledge behind all of this. Well, someone have a question. If a friend of mine have endometriosis, are regular pap smears and HPV tests recommended? Also, is it normal to still experience menstrual bleeding while taking Visan? Be sane.
Okay, I will qualify here that I'm not a gynecologist. Okay, so I don't usually prescribe this medication, so I will not answer that question.
Okay.
But okay, if you have endometriosis, that is just disordered thickening of the lining of your uterus. Okay, that actually doesn't have anything much to do with your cervix. So you should still go for you should still go for your pap smears and yeah.
Yeah, so pap smears every 3 years. HPV test every 5 years, just to be safe. Okay. Another question. Let me see. This is a myth, okay, that she wants to check in on. Can I check? Does pineapple juice help at all? If my period doesn't come and I'm told to drink pineapple juice, does it really help at all?
I think that is a myth. Okay. Again, I don't think there is high level clinical evidence to show that it helps. So I'm afraid, yes, I think that's still going to have to fall under myths.
Okay, so the only way to get your period to come is to consult a doctor and see what can be done.
Yeah.
Okay. Post-surgery for stage 1 cancer with no spread to lymph nodes. Doctor feels no need for radiotherapy, etc., but I feel worried. What's your take, Michelle? Thanks.
Okay, so for stage 1, I assume cervical cancer. There are a few other factors that we need to look at.
Okay.
So it does mean that I need to take a closer look at the surgery report and what comes there. There are certain things that are sort of make us a little bit more worried, such as things like if the margins when they cut, it's very close or if it's positive. Those are indications that actually we will want to consider radiation. So for this lady, I unfortunately can't give you a very concrete answer right now. I would need to actually have a detailed look at your surgery reports and then have a discussion. Happy to see you for second opinion and take it from there.
aaro.sg.
Or feel free to drop me a DM as well on my Instagram, which is drmichellesingh.radong. I'm happy to do it over there as well.
Okay, I'm sure you get a lot of DMs tonight, doctor. Okay. Another question. As I'm having amenorrhea and went to gynae, results came out that I have high levels of prolactin. I ate the meds doc prescribed and the blood came out watery. Is it normal?
The blood came out watery. Okay. So again, sorry, I'm not a gynecologist. Okay. So these questions are probably more suited for a gynecologist. It probably doesn't mean that she has any cancer. So
Right.
I don't think whether it comes out watery, that one again, I'm not really sure what happens when you take the medication. I don't know what medication you were given. So I'm afraid I can't comment.
Okay, so basically consult a doctor.
Yes.
Yeah. And okay, do we still have any last questions? None here? All good. I hope we answered a lot of your burning questions that you might have today in a very safe and comfortable, intimate environment. I feel like I learned a lot from both Karen and Michelle. I can't imagine if I were the one who have had to go through this process, how I would feel. Probably all the emotions that Karen has felt and, battling cancer. I'm so proud of you, girl.
Thank you.
And yeah, just the very first step, like Dr. Michelle mentioned, go for screening early because that's the only way you can catch cancer, right? And then from there, we work on ourselves. Well, any final words to our viewers here, Michelle?
Well, thank you for listening. I hope that, whatever you've heard today, you actually take action, as Hazel has said. And stay healthy, live healthy lifestyles. That's the best way to protect your health.
Less mala, but not that I can't have it at all.
Yes.
And what about you, Karen? Any final words?
Prevention is better than cure. Let's go for your screening.
Yeah, don't be scared, okay? You've heard it from a cancer survivor here. Thank you so much, guys, for joining us on a Tuesday evening on Girls Talk with SES. And thank you so much, Karen and Michelle.
Thank you. Thanks
We'll
for
see you guys
having
next
us.
time.